Hello, my name is Carla Martinez, and I study of Universidad Católica Santiago de Guayaquil. I am going to talking about the insulin-mediated lipohypertrophy. Definition: lipohypertrophy has been suggested as an outcome of lipogenic action of insulin and or injection-related tooth trauma. Repeated subcutaneous administration of insulin in the smaller area mode on the local lipogenic effect of insulin and injection-related tooth trauma. Consequently, insulin lipohypertrophy in front of fatty lipus underneath the skin of an area. It occurs especially in type 1 diabetics. Application in medicine. Cause: high prevalence in patients who don't use a large injection area. Insulin injection series are not road regulation. They administer conventional premixed insulin. Neither result special neither result greater than 3 times have a low body mass index. Early detection and timely correction or injection techniques are essential to research the complication, identify areas at risk, and speaking with the health care providing to check injection cities should be part of any diabetes care plan. Do avoiding this complication or reserve it you must. Propose an injection city rotation plan and skin with it. Use new needles. Level about 25 mm in each of distance between injection series. Be about in the areas where the lipo has already apparent usually but not always the issue with health. Permanently review injection series with your medical teams. Awareness and management of the lipohypertrophy among healthcare providers and people with diabetes is key to the causes of any insulin therapy. Pros and cons. Pros: treatment consists of rotation insulin injection, the more frequent and avoiding areas of lipohypertrophy altogether. It was avoided on this if you avoiding injecting into the area. Cons: local increase in the volume of adipose tissue due to the lipogenic effect of insulin. It causes delay in the absorption of the administration medication, which can lead to difficult controlling blood sugar. Insert applied in Ecuador. According to the MSP in Ecuador, diabetes is the second cause of death after ischemic heart design. Most diabetics who injected insulin suffer from lipohypertrophy. The imprints can use the organism insulin turnover, such as those developed by Becton Dickinson or Novo Nordisk. Hint is why the activity decreases the factor that produces the appearance of insulin lipohypertrophy. Conclusion: rotation of injection over large area and the use of long-acting and the rapid-acting insulin analog in the patient with type 1 diabetes are the amine and modifiable factor to minimizing insulin-related lipohypertrophy. The health professional recommend to carry out the adequate and the timeless sense than the observation of the areas where the insulin termination for the purpose of the prevent, diagnostic, and the treatment insulin lipohypertrophy in time.
This is Mr. Danny. He's a 48-year-old businessman. He's diabetic from the past 10 years and on insulin since then. One morning, while jogging in the park, Danny meets his friend Rosario. Mr. Rosario is a 55-year-old lawyer and is also a diabetic patient since 18 years. Danny calls Rosario to come and sit on a nearby bench in the park. While talking, Rosario suddenly notices a small lump on Danny's thigh and asks what this lump is. Danny explains that is the injection mark of insulin. Rosario looks surprised and inquires Danny if he is taking injection on the same site daily. Danny calmly accepts that he daily injects the insulin on thighs because because it is painless and more comfortable. Moreover, it has become his daily habit. Rosario understands that it is lipohypertrophy and explains to Danny. The most common cause of lipohypertrophy is receiving multiple injections in the same area of skin over an extended period of time. Other causes include repeated use of same needle. Rosario concernedly exclaims that Danny is probably practicing a wrong habit. Rosario explains that insulin injection sites must be rotated daily and even he is doing the same. He also informs that if insulin is continuously injected on this lump area, then insulin absorption will be affected and controlling blood sugar may become difficult. He advises Danny to get an appointment with his diabetologist. The doctor explains Danny that he is having lipohypertrophy. He advises the preventive and management techniques to Danny. Regular inspection and palpation of insulin sites. Do not reuse needles. Follow correct site rotation techniques. Use large surface areas for injection. When injecting near previous site, leave 1 inch of space between the two. Reduce dose of insulin in habitual lipohypertrophy site injections when shifting to normal subcutaneous tissue. Rule out lipohypertrophy as a cause of poor glycemic control, hyperglycemia, and high glycemic variability. Inspect injection sites on your own. Look for areas that appear raised or puffy. Feel for hard or rubbery lumps or bumps under your skin. Make sure to report any findings to your physician. Emphasizing the importance of insulin injection site rotation can help patients to control sugar and even prevent future episodes of lipohypertrophy.
Thanks.